Hi everyone, we're back, and this time it's the new nurse with anticoagulation therapy. Here we have a patient who is in the PACU, post-anesthesia care unit, following surgery to her cervical spine. She's also on anticoagulation therapy for a past history of atrial fibrillation. If you'd like to learn more, please go to Chapter 2 of dearnurses.net, Pharmacology for Nurses in the Clinical Setting. It is important to assess and document any signs of bleeding from drains, dressing sites, urinary output, mucous membranes. Lab values are usually done, and therapeutic levels, if they're not, the doctor usually gives orders how to balance them up. If you take a look at this patient, everything is nice and clean. She's got clear urine. She hasn't got bleeding coming from anywhere. Now let's take a look at the next patient who's on a heparin drip, who is saying, "Nurse, my dressing is covered in blood. Why is my dressing covered in blood?" Well, this nurse is saying, "Let me call the supervisor." Well, that is not appropriate. My suggestion, if this should happen to you, here is a helpful hint. You need to assess that patient and find out exactly why is they're bleeding on the dressing, blood on the dressing. Patients on anticoagulant therapy it's a blood thinner, can have problems with bleeding from the gums, from the urine, from the dressing site. Suggesting, again, helpful hint, documentation and assessing, of course, documentation and letting the doctor know. If you'd like to learn more about anticoagulation therapy, please go to Pharmacology for Nurses in the Clinical Setting, Chapter 2 at dearnurses.net. This is only very brief. There's tons of helpful information, and also at dearnurses.com on atrial fibrillation. Have a nice day.